Blindness is not only the most dramatic and severe disability to strike a human being, but it is also a public health problem worldwide because of its social and economic consequences. Currently, there exist 300,000 blind people and 700,000 people with severe visual deficiency in Peru. This number is constantly increasing, despite the fact that 8 out of 10 people suffer from preventable or curable blindness. On fighting blindness, Peru has an exceptional story to tell regarding a pioneering worldwide work in this respect. In the 1980s, Peru was strongly hit by hyperinflation and terrorism. Poverty afflicted most of the population, which in turn struck the people's health care. This could be observed in the high rates of infectious disease, malnutrition, and maternal and infant mortality. In addition to that, the lack of ophthalmologists and eye care was such that eye disease inexorably led to blindness. At the beginning, Dr. Carlos Wong's solitary work to detect blindness was carried out by attending to patients in tents. At that time, there were a few initiatives to prevent blindness worldwide.
Las personas ciegas. La tragedia de estas personas es que en su gran mayoría no deberían estar sumidas en la oscuridad, puesto que su ceguera es prevenible o curable. Para hablar sobre el tema nos encontramos con el doctor Carlos Wong, director ejecutivo de la Organización Peruana de Lucha contra la Ceguera o Peluce. Doctor Wong, buenas tardes, bienvenido a Día a Día.
Buenas tardes.
La ceguera, como lo dije hace un instante, pues es considerado el mal de males, la mayor en cuanto a lo que es la pérdida de algún sentido. Pero en sí, ¿qué es la ceguera? ¿Qué conocemos de la ceguera?
Bueno, la ceguera muchas veces, en el concepto de la gente que no padece la vista, piensa que tiene que ser una pérdida total, una oscuridad total, lo cual no es cierto porque hay diferentes grados, de los cuales la pérdida absoluta de la visión, la oscuridad total, esa es la ceguera absoluta, pero existen otros donde la persona está incapacitada.
In 1978, Dr. Carlos Wong founded the Peruvian organization to fight blindness, OPELUCHE, Organización Peruana de Lucha contra la Ceguera, a non-profit association aiming at fighting blindness in its own domain. To this end, Dr. Wong designed an integral eye healthcare model intended to prevent and cure blindness, plus offering rehabilitation as needed for the assisted population. Later, several satellite clinics were set up in the huge poverty belt of the capital city of Lima with the support of the Christopher Blindenmission Foundation, CBM, from Germany. Projecting to the whole country, itinerant programs are carried out in the remote rural areas of the coast, the Andean highlands, and the Amazon rainforest, with the support of the Helen Keller International (HKI) Foundations of the United States of North America and Professor Vive Stichting Foundation (PWS) of the Netherlands. As a main strategy, training is carried out for the primary eye health human resources, such as health personnel, teachers, and promoters, who are the ones to provide support and continuity to the programs.
Sanitary education for the community, surgeon assistance, and rehabilitation of the blind, donation to the poor patients. Another task performed by OPELUCE is
Education and the promotion of eye health in the media are permanent activities meant to achieve the community engagement, such as the educational program Look for Those Who Cannot See, interviews on radio, TV, and newspapers, training of school correspondents, celebration of the World's Day of Vision, the short film Probing into Darkness about the rehabilitation of the blind, detection campaigns of glaucoma and diabetes. Travel for carrying personnel, medical instruments, and supplies to towns and villages up to 1,500 kilometers from Lima is carried out by using the most varied means of transportation. These trips are made through the rugged geography of the country, either towards the tropical coast, the Andean mountains with populations located at more than 4,000 meters above sea level, or into the immense Amazon jungle. Traveling to remote towns, the participating ophthalmologists are volunteers offering their services for free with admirable dedication, despite the enormous number of patients to attend and surgical interventions to carry out. In every town, there is a huge accumulated demand for specialized eye care. The people show up in great numbers, which is why proper planning is required. Children's visual complaints are attended as a priority to achieve an early detection of eye affections. School programs allow us to detect a high percentage of students with refractive defects, as well as strabismus and amblyopia conditions that affect school performance, and it could be mostly solved with the use of corrective glasses or specialized treatment. Child blindness is a devastating problem whose consequences involve both their personal development and family commitment. Blindness due to corneal injuries, mainly caused by neonatal infections, malnutrition, vitamin A deficiency, and measles. On the other hand, findings of sequels of ocular trauma, general toxoplasmosis infections, infantile cataract, congenital glaucoma, familiar microphthalmos, Hallermann-Streiff syndrome, tumors, hemangioma, and other congenital malformations are more serious challenges that must be referenced to centers of greater complexity. Atrophic eyes are very frequent. Currently, with the increased survival of premature babies, blindness due to retinopathy of prematurity is on the rise. Blindness affects many people over 50 years of age, and it becomes extremely severe due to scarce specialized service. Cataracts are the first cause of blindness, in spite of being a curable blindness by excellence, since patients can recover from vision by means of surgical intervention, in which the ossified lens is removed and replaced with an intraocular lens. Unfortunately, most patients ignore, fear, or cannot access this kind of surgery. The presence of fleshy masses of thickened conjunctiva, or pterygium, is very common in the Andean highlands and in the Amazon rainforest, where this affection very frequently evolves into blindness. These cases often require protection against solar radiation and surgical interventions. Glaucoma, the fearsome so-called silent vision thief, is the main cause of incurable blindness due to an increased eye pressure and other factors. This disease affects mainly adults, which is why campaigns are carried out for its detection and early treatment before it leads to blindness. Other important causes of vision loss are damage to the retina caused by diabetes and macular degeneration, which must be referred to specialized centers. Trachoma, the world's most common infectious disease causing blindness, which affects people lacking environmental sanitation, is widely spread in the aboriginal towns of the Amazon rainforest and it may even reach urban areas through migration. For the first time ever, our studies have shown its endemic presence in America, as it has been published in PLOS in 2016. Leprosy, or Hansen's disease, the fearsome biblical disease, is a generalized infection that produces progressive mutilations throughout the body, also affecting the eyes. It has called our special attention in the rainforest areas, oftentimes with having to perform vision recovery surgery. Trauma, infections, and ocular cancer cause dramatic cases of blindness that are fully manifested due to the lack of timely care or lack of specialized services, which may even cause vast damage to the eyes. These cases move our sensitiveness very deeply due to the discovery of the most pathetic cases imaginable that have been left to their own devices. Surgical interventions are essential to solve many cases of blindness. Despite the fact that health centers are quite precarious in rural areas, 25,000 surgeries carried out prove their effectiveness by helping improve the vision and quality of life of the affected people, who recover faith and hope. For those who suffered from unrecoverable blindness, we were able to develop a rural rehabilitation program for the blind in 14 towns of the Andean highlands of the Department of Ancash, where 25 trained rehabilitators provided training to 150 blind people in their own communities in the areas of orientation and mobility, manual dexterity, daily activities, agricultural work, and psychological counseling. This program, which is one of the first programs of its kind in the world, demonstrated that the blind can be rehabilitated and reinserted into their community under the sponsorship of the Helen Keller International Foundation, HKI, of the United States of North America, and the support of the Peruvian Ministry of Education. The achievement of this endeavor over 3 decades show that it is possible to bring specialized care to faraway places if planned adequately. They can be summarized in 1 million ophthalmological consultations, 25,000 surgical interventions, with 40,000 people saved from blindness. The academic contribution and epidemiological research have been decisive in fighting blindness in Peru, including 170 epidemiological studies, with 3 studies of prevalence and causes of blindness, the first national plan for blindness prevention in Peru, management of the Peruvian Congress for Blindness Prevention, publication of Peruvian Archives of Ophthalmology magazine, and the book Eye Diseases and Blindness in Peru. Traveling to the Andean highlands of the Department of Piura, we reached a remote and very poor town of Huarmaca, located at 4,200 meters above sea level. We found Lucia, a 4-year-old little girl who suffered from congenital cataracts that caused blindness and also impeded psychomotor development. Despite the precarious conditions of the health post, we proceeded to operate both eyes. The next day, we put corrective glasses on her, and she was able to see her parents for the first time, representing a moment of great emotion. 30 years later, we saw her again. Due to the fact that the region had suffered terrorist violence, she had become a worthy lawyer. This is one of the people that we have had the opportunity to know of the long-term benefits of our humanitarian work.
Everardo Barojas and Dr. Juan Batlle on the Kupfer Award Review Committee in anticipation
Awards and
of
recognitions.
nominees for the next award at the 24th
This pioneering
Congress
endeavor to
in
fight blindness has had
2003.
wide national and international recognition, being worth highlighting Pan American Karl Kupfer Award for the prevention of blindness, Queen Sofia of Spain Prize for the prevention of disabilities. The great efforts to reduce blindness and its dramatic consequences constitute a continuous endeavor that should be supported despite the great obstacles to overcome, since the number of blind people is constantly increasing, as blindness is always lurking, regardless of age or social condition. Our humanitarian motivation has shown that quality specialized care can be provided even with limited resources. This presentation can make you feel to believe.